Hey guys, it's Liz. Welcome back to another episode of Closed Doors. It's been a while. I'm not crying. I was crying a little bit earlier actually, but my nose just got clogged out of nowhere. Um so what happened since I've last been here? Let's be honest here. I got my tonsils removed. That was hell. The process itself wasn't that bad. If you're wondering why I got my tonsils removed, I got constant strep throat for 12 consecutive months. And I was like, I'm done. So I went to an ENT and he's like, yeah, you can get those removed. And I'm like, okay, great, let's take them out because I'm tired of getting strep throat every month for a year. Like, I got strep throat every single month for a fucking year straight. That's the worst thing that's probably like absolute hell. That's actually the reason I didn't work Black Friday last year. I did get to work Black Friday this year, and I'm very happy about it because it wasn't as bad as I thought. But then again, this is a bit of a different year. Q 2020 countdown. Please, dear God, I'm done with this year. But no, last year, what happened? What had happened was the day before Thanksgiving, I got my tongue pierced, which was not the smartest idea, in case you were wondering. So the next day, I come back. I'm hanging out with an old friend, a friend that I'm no longer friends with. And we're having Thanksgiving at her house. We're getting everything ready. And we had to go to Walgreens to get frosting, I think it was. And I was very thoroughly wondering why my throat felt swollen and like I couldn't breathe. So I open the car mirror and I look at my throat in the mirror and I see strep throat. In case you're wondering what strep throat looks like, you get these white and black spots all over the back of your throat, and it looks disgusting. And I was like, again? Again. Mind you, that was Thanksgiving Day. So I'm not going to message my boss and let her know, hey, remember how you have me scheduled for tomorrow from 2 o'clock to 7 o'clock? Yeah, I can't because I have strep throat. That's a last minute thing, and I hated that. The next day I show up to work and I'm like, yo, so I have strep throat. It's not contagious, which is what I was told by the guy at the urgent care. Don't worry, because I did go to urgent care. I got my antibiotics and everything. I'm like, yeah, I got strep throat. I don't know what you want me to do. And I was sent home. So no Black Friday for me last year. But this year was nice. I didn't have strep throat, so that's great. I haven't had strep throat since I got the surgery, actually. Recovery was hell, in case you were wondering. It was, well, the first day was pretty bad, but I was also still hyped up on anesthesia. Thus, the video clips that you saw in the video where I talked about getting strep throat, I think it was the Medusa video. Yes, it was. I remember because the day filming the actual look, I was still recovering from surgery. I think that was like the last day before I was like, okay, I can go back to work now. I was barely talking. You can ask Reno. He was like, are you good? I'm like, I'm great. I'm great. But no, recovery sucked. There was 2 or 3 days where I just cried from the amount of pain I was in. Oop, I just kicked my mic. That's great. I was trying to get my stool closer so I could put my feet up. I'm just going to put them up on my nightstand. That's fine. That's sexy. But it wasn't the best experience. Woohoo. Hello, it's a foot. I'm sorry, I'm trying to get comfortable. It was not the best experience of my life. 10 out of 10 would not recommend as an adult. I don't know what it's like to get it done as a child. My sister got her tonsils removed when she was 6, I think. So I would have been 4. I don't remember her crying as much as I did. And I have a very high pain tolerance. I would like to say that I do have a very high pain tolerance. But that sucked. Um, since the last podcast, also, I have promised a friend of mine to do a very long, it's probably going to be 5 hours long, I'm not going to lie, podcast on why I hate people. Now, there is only one reason why I'm not doing that today. And that is because apparently I don't have the battery for it. I have 20% battery remaining. That's fun. Um, we're gonna keep going. I might have to cut and come back to this later. But I don't have the time for it. I'm getting another surgery tomorrow. And I wanted to put out another podcast before the surgery so that in the event something happens, that sounds like I think I'm gonna die, which I'll get into that in a minute, but in the event that something happens, I've at least come to peace with it. Does that make sense? So I'm getting my gallbladder removed. And you're probably sitting here wondering, why are you getting 2 body parts removed in 1 year? The answer is, I have something called Ehlers-Danlos, which basically makes your body fall apart. I keep hitting my mic. I'm so sorry. It basically makes your body fall apart. That's the explanation I'm going to give for the rest of my life, most likely. But the scientific answer is it's a genetic disorder that affects the collagen and connective tissue in your body. And for a lot of HEDS patients, hypermobility type Ehlers-Danlos patients, they can have gastrointestinal issues. Now, beyond that, I have a long family history of gallbladder issues. My grandmother died of gallbladder cancer when I was in 7th grade. My mom had hers removed. All of my great aunts on my dad's side have had theirs removed. Apparently one of them had their gallbladder flipped with their liver, which is why it had to be removed, which was interesting. But my gallbladder is just not functioning. I had a scare in July, not January, July, of my gallbladder. It just didn't want to work, you know? So I was driving my dad and I back to the hotel from my mom's house, and I started getting a very intense pain behind my right side rib cage, and I couldn't drive. I felt like I was gonna throw up. I pulled over. I told my dad to drive, and he asked me if I wanted to go to the ER, and I told him this is the worst pain I've ever felt, which is a fact. Like, despite the fact, well, at the time it's a fact, because the worst pain I've ever felt was actually recovering from my tonsils being removed. That was fucking hell. 10 out of 10 do not recommend. But we went to the ER. They sent me home with constipation. I was like, bitch, I'm not constipated. What are you on? Went to my primary doctor. My primary doctor told me, yeah, that sounds like your gallbladder. I want to do this test. And I'm like, cool, let's do it. Months pass. Never got the test appointment. Nothing. Skip to election day 2020. I get the hepatobiliary scan, is what it's called. You sit in, if you've ever had an MRI, just picture getting an MRI, but on your abdomen. If you've never gotten an MRI, just imagine like how do I describe this? Imagine a donut. Imagine a metal donut. And there's a little bed coming out of the donut hole. And there's a panel the size of a couch cushion just floating over your abdomen. And you lay there for an hour. And an hour later, after that hour is over actually, they inject you with something to make your gallbladder contract. Wow, I wanted to vomit. It was awful. Absolutely awful. And they went for another 30 minutes, sent me home. Turns out my gallbladder is at 18% functionality. And that is called gallbladder dysgenesia. So basically your gallbladder is not functioning the way it's supposed to. It's not pumping at the rate it's supposed to. And I'm like, cool. So I'm getting my gallbladder removed tomorrow. And I'm terrified. And the reason I'm terrified, and maybe this is what made my tonsillectomy a little bit easier on me. I had my dad with me for my tonsillectomy. That's the removal of your tonsils, in case anybody's not following the medical terms. But for this one, because of a lovely thing that shall not be named, I'm not allowed to have anybody with me. And I'm sorry, I might be 19 years old. But I want to make sure that I don't die. When I went to get the blood work and the COVID test for the surgery, I got stabbed 9 times by the lady doing the blood work because she wouldn't listen to me when I said, you need to give it a moment for my vein to show up. Every time I get my blood drawn, it's always on my left arm because I have a really good vein on my left arm. My right arm, not so much. It's too much to the side. But my left arm, yes. But she tried putting the tourniquet on me. For some reason, I always have a reaction to the tourniquets, despite the fact that they shouldn't be latex. Whatever. And I told the lady, I'm like, look, don't use a tourniquet on me. I'm going to have an allergic reaction. Didn't listen to me. Puts the tourniquet on me. And I told her, I tried to take it off. She's like, you need to leave it on. I'm like, I'm allergic to that. So I don't know what you want me to do. And she's like, you're going to be fine. Not even a minute later, I start having hives up my arm, which is making her job of failing at stabbing me a lot harder. Go figure. Easier technically with the way that I said that. And I'm getting really mad at this lady because I'm like, dude, I told you I was allergic to this. You're stabbing me like 7 times. It got to the point where I physically pulled my arm away from her, slightly bleeding because she had stabbed me 9 times at this point. Took the tourniquet off and I said, I want somebody else to do this because you are hurting me and I need Benadryl or epinephrine, which are both allergy medications to help with allergic reactions. Calls another person in and I'm like, hey, trying to get blood work done. She's not listening to me when I speak. I'm having an allergic reaction. I need something. They're like, no, you're fine. I'm like, do you not see these hives up my arm? I'm having an allergic reaction and I need something to help with it. I'm allergic to latex. They're like, oh, but the tourniquet's not latex. And I'm like, okay, but it doesn't matter because I'm still having an allergic reaction to this and it's your fault because you didn't listen to me when I said I have a reaction to it. Same guy puts another tourniquet on me. And then tries to stab me. And I'm like, you aren't listening to me. So I'm pitching a fit at this point, pretty much. And I'm like, I need somebody who's going to listen to me and not completely ignore what I'm saying because I'm the one being affected by it. Another person comes in. What's the problem? Hi. Nobody's listening to me when I'm saying I'm allergic to the material in the tourniquet. I don't care if it's not latex or not. I'm clearly having a reaction to it. Look at my arm. It's harder for me to breathe at this point. That's how bad of an allergic reaction I was having. It's going up my arm. I was wearing a hoodie because I'm always cold. And it was cold outside in the morning. And I put my sleeve back through the hoodie and I pulled the sleeve up to where it was acting like a tourniquet. And I was like, look, just use my sleeve as a tourniquet and give it a minute. And my vein will appear. Just trust me on this. I'm tired of getting stabbed and everybody missing my vein. He's like, okay, cool. So he waited with me and then I was like, okay, my vein's right here. It's this is the vein you want to go for. And he's like, all right, cool. So he, first fucking try, mind you, because people don't know how to listen to you. I find it so funny that when you are an educated patient, nobody in the medical field wants to listen to you. I find that to be the most frustrating thing because there have been times where I've walked, like I said, I got strep throat for a year straight every single month. 4 or 5 times I walked into the urgent care and I told them flat out, I have strep throat, I just need an antibiotic. And they're like, we have to test you for it. Didn't listen to me, wanted to say that I had a cold, say that I have a flu, say that I have an upper respiratory infection, which is a cold, if you didn't know. And I'm sitting there telling them, like, no, look at my throat. It's strep throat. They're not listening to me. And it's happened 4 to 5 times. And at one point, I remember specifically, I looked this guy dead in the eyes because he's like, oh, well, it could just be that you're having a bad period day. And I was like, are you licensed? Because I was so pissed off at that point because he had blamed it on me being overweight, which I am, but also you don't have to point it out and say that I'm having fucking strep throat because I'm overweight. Like, that's not what's happening here. I know that's not what's happening here because strep throat's a bacterial infection. But anyway, this guy had insulted me on so many levels, and I was like, do you have a license? And he's like, of course I do, otherwise I wouldn't be practicing medicine. I'm like, okay, aren't you supposed to listen to your patient's symptoms? Well, yeah, I am, but also you're not listening to anything I'm telling you. Like, because I already know what I have. I came here to get antibiotics for it. And he's like, what do you have? I said, I have strep throat. He's like, okay, we're going to do a rapid strep then. I'm like, do it. Comes back positive. Because nobody listens to me. I've said this when I was talking about having Ehlers-Danlos and my diagnosis story. I told them for over a year, there is something wrong. I don't know what it is, but it's not this that you're telling me. It took me a year to get diagnosed. Almost 2 years to get diagnosed with Ehlers-Danlos because I wasn't listened to. And I really think that medical professionals need to listen to their patients more to avoid misdiagnosis, to avoid confusion, to avoid potential harm to the patient, aka an allergic reaction, because you're not listening to me when I say I'm allergic to the tourniquet. But I digress. But no. So I'm getting surgery tomorrow. And not gonna lie, slightly terrified. By slightly, I mean very. I've always known, having the Ehlers-Danlos, that it was a possibility that an organ would fail. In this case, it's my gallbladder. And I think because of that, I'm slightly better mentally prepared. But at the same time, I'm also a lot more scared. Because I know the risks that come with having surgery, especially for a patient with Ehlers-Danlos. It's scary to have a condition that causes something and then makes the solution to that problem even more difficult. Patients with Ehlers-Danlos are more likely to bleed out. They are more likely to not form blood clots and bleed out, like I was saying. They're a lot more likely to get infected. They have a harder time healing. And to think that all of this could come from fixing a problem that this disorder caused is terrifying. I don't want to think that I'm gonna die. I don't want to think that because of this I could end up fucked. I mean, I think my biggest fear coming out of this surgery is can I eat anything afterwards? And that sounds a little weird, but it's also my mom, when she got hers removed, she can no longer have gluten, a certain kind of smoke thing that's put into barbecue sauce, apparently. I didn't know that existed. Synthetic smoke or something like that. She can't have soy. I think she can't have certain types of meat or eggs or milk. I could be very wrong on quite a few of those. But I know she can't have a lot more things. And now she has a very strict diet she has to follow. I'm not sure if you guys know, but I don't eat like a normal adult. I eat like a child. And by that I mean chicken nuggets are probably the only meal I will consistently eat no matter where it's from. With that being said, I'm scared that I am going to have to change my diet and what I normally eat. And because of that, my dad's been telling me all day, like, we should go grocery shopping so you have things to eat after surgery. I'm like, I don't know what I'm going to be able to eat after surgery. Because the surgeon told me I don't like putting restrictions on my patients. But for you, you're not allowed to have you lift for 2 months. And I'm like, great, what about eating? He's like, we'll see how you feel. And I'm like, oh, interesting. I'm mainly scared about my diet changing. It's a vigorous process for this pre-operative period. I'm getting surgery tomorrow. I think I've said that like 5 times now, but let me just say that one more time so you can understand the magnitude of things that I have to do today. Well, actually, there's one thing I can't do at all today, and that's smoke. And I know I said I wasn't going to talk about smoking, but I'm not allowed to smoke anything, any form of anything at all today. And I haven't, thank God. And I'm just sitting here like, I'm kind of caught up in my feelings right now. Does that make sense? Let me adjust. I'm kind of just wallowing in my emotions right now. And that's because I don't have the help of marijuana or nicotine to relax right now. And that's, let me adjust again. Hold up. Ooh. And, you know, I think I spoke about it briefly before, but the two reasons that I smoke to begin with is pain relief, specifically towards marijuana, and stress relief, anxiety, things like that. And the night before a massive surgery is a night that you'd think people would pop their anxiety medication. I can't take anything. I'm not allowed to take anything. I'm not allowed to drink anything. I'm talking about alcohol here. Not even that, like, I would drink before surgery. That's a stupid thing to do. But I don't know what the fuck I'm talking about here. But it's scary. It's scary. Because I don't have an aid to help me just forget my thoughts. I'm kind of just stuck in them. And that sucks. And I think avoiding feeling all of my thoughts at once is one of the reasons that I turned towards smoking. It's just the idea of having some clarity to work through my thoughts. I find it a lot easier for me to dissect my thoughts when I don't have barriers in my head. Does that make sense? I feel like I'm talking about this a lot more than I want to. But I have to wash all of my sheets tonight. I have to wash myself with a bottle of antibacterial body soap that is the size of a Coca-Cola can. Bottle. I have to use half of that tonight, and the other half tomorrow morning. So I have to take 2 showers within a 12-hour period. So I don't know how I feel about that. I'm the kind of person to shower like once every 3 days. I'm not gonna lie. I ain't nobody got time for that when you literally are up at like 6 in the morning to drive kids to school, get home after 10 because you closed. You know, that's the kind of life that I live. I'm a very busy person. 10% battery. I'm a very, very busy person. And that's fine. I don't mind being busy. I mind that I looked fat in that shot. That's amazing. Oh, God. But, I mean, I keep myself very busy. I don't remember what I was talking about. I'm a very busy person. That's all I know that I was thinking about. And I have to wash all of my sheets. I have to kick my cat out of my room. Oh, I remember what I was talking about. I was talking about what I have to do today pre-surgery. And then because I said I only shower like twice a week. There we go. Now I'm on the right track. I have to wash my sheets. My cat cannot sleep with me tonight. So I have to move her food, her water, and her litter box out of my room and into another room that I can hold her in. Which is like, the entire time that I've had my cat for the last 3 years, she's never slept without me outside of my room. If I'm not here, she's sleeping in the room. Or she's with me wherever I am. And this is the first night she's not going to be able to be with me. And it's scary because I'm used to having a little fluffy cat in the morning waking me up, and I can tell she's scared too because she's an emotional support animal, and she's super super loving, super affectionate, but she gets scared too, and that's fine. But the problem is I can feel all of her fear just kind of building up, and she's become a lot more skittish, and she's following me around the house a lot more because she knows, like, I have a feeling in her heart she knows, like, mom's getting surgery, mom's gonna do something else. And it sucks because I love her, and I don't want her to be scared. I don't want her to worry. I mean, I watched her grow up, and I've raised her, and it sucks to not be able to have her with me on a very scary night. But I gotta do what I gotta do, right? Oh my god, I love my cat so much. I was actually telling my dad if anything happens that Bubbles is gonna go to my sister, and she's gonna have to figure out how to get her dog to like Bubbles and Bubbles to like the dog. I'm crying. This is what I meant by I'm just wallowing in my emotions. I just hit that so hard. I wanted to make a podcast for you guys because I think it's important to be able to be open about your fears. I mean, I'm not a big creator by any means. I have maybe, I think last time I checked, I was at like 60 subscribers. I'm getting some good views recently. Thank you for that. But as a smaller creator, very small creator, I always want to speak about the things that are affecting my life. So you guys don't get discouraged if you don't see me uploading for months. I'm a busy person, and I really enjoy making these podcasts and these videos for you guys. I have a lot of fun doing it, and it's not because I'm waiting for something to happen with this. It's because it's an outlet for me. This is a place I can go. It's a safe space. It's part of the reasons I created Closed Doors to begin with, a safe space for me to just talk through what I'm feeling and through what I've experienced, and talk about things that I don't typically talk about in depth. And I really want to go into depth about a lot of topics, and I haven't yet. My podcasts have mainly been just like tea and shitty stuff that's happening to me. But I will make that podcast about why I hate people, and in that podcast there will be a lot of cuts. I'm not gonna lie, because I genuinely think it's gonna end up being 5 hours long because I'm so passionate about that topic. But I want to sit here and talk about important issues and talk about things that nobody else wants to talk about, like mental health. Nobody else wants to sit here and talk about defunding the police. Nobody else wants to sit here and talk about, the worst drivers in the world, which I can tell you right now, half of them live in Miami, the other half probably live in Los Angeles, but I've never been to Los Angeles, so I can only say Miami fucking sucks. So I'm gonna have an entire video on why I hate Miami too, I promise. But there's a lot of things I want to talk about and explain, and Closed Doors is just, it's a metaphor for me. Closed Doors is a safe space. You're in that safe space, shut away from the rest of the world, and you can talk about what you really want to talk about because there's nobody around to judge you. There's nobody around to sit here and tell you you're wrong. And maybe you'll hear it in the comments. Maybe you'll see it in the comments. But how often do I check the comments? And at the end of the day, I know I'll feel better knowing I have shared this. So, with that being said, because my phone is dying, and I record on my phone, and the fact that I have a lot to do, I wanted to make this video to update you guys and let you know, hey, I'm getting surgery, and I'm terrified, but I will be getting back to you guys with another podcast, hopefully very soon, as soon as I possibly can. I probably won't make some normal content until next year, but I do want to put out another podcast before next year, hopefully. Maybe I'll ring in the new year with why I hate people, I don't know. But I want to thank you guys for watching this condensed version of a podcast, and please subscribe if you want to hear more. Comment down below what you want to hear me talk about, because I'm down to talk. I love talking. I don't like doing it with certain people, but I love talking. And like this video if you liked it. And you know what? Do me a favor. Comment down below what you are most terrified of. And if you know why. Why? Because I'm curious. I want to know why people fear things. And I'm going to talk about that in another podcast, because I've had a thorough train of thoughts, but my phone's going to die. All right. I'll see you guys in the next one. Bye.